Welcome back to Healthwise. Dr. Gabby and I was talking, well, you mind Gabby?
No, I don't mind at all, Reggie.
We're talking about the diabetes and how it affects us in this area. And Doc, is there anything that you would want to tell the audience as far as ways to, prevent it, and also what they should do if they suspect, and also how often should they come see you?
Oh, okay. Well, usually the patients, as soon as they have any kind of, I would say, like intrigue, or, they kind of know, like, I should go see the doctor, go see your doctor. Usually sometimes if they don't feel anything, or they just, they try to blame it on the flu or because of stress and work, then they decide not to go to the doctor. And sometimes you never know, they might be running with high blood sugars. I usually recommend everyone to get in touch with their primary care doctor and ask about the screenings, if they will qualify for having any kind of screenings, and also based on their family history. You can also ask around. Some people, they might not know, I never knew that diabetes run in my family, and then they just find out. So that's important. Another thing is, with the doctor, with your primary care physician, you can always talk to them about what can I do to help control my diabetes. What can I do? What kind of medication would I need? Also, what type of diet they can follow, even an exercise plan. And as I said, it's a basic team effort. Usually my patients who are diabetic, I really like to follow them very closely. The further that I can put them probably would be like 3 months. Okay. Sometimes, unless they're like several years, being like the best, what we call like the best prototype patient, that blood sugars are controlled and they're taking all the medications and they're compliant, following exercise, diet, which, unfortunately, not everyone we see is like that. We have deal with compliance, or I have had patients that they have their blood sugars normalized and they think that they're cured. Diabetes, there's no cure for diabetes. We can keep it under control and slow the progression and also all the complications, and we can get to your normal levels for having blood sugars. But what I want to try to tell my patients is, I don't want them to feel discouraged, because sometimes even if any kind of doctor would adjust the medications, it's basically for better care. Mm-hmm. It's not that you're not getting the best medication that there is for you, and also the patient cannot have any self-blame or guilt because their blood sugars are not well controlled.
Right. Well, Doc, like I said, in this area, I think we'll find that, and I think you will too, that you'll have more non-compliance than compliance. I mean, it's just hard with the food and
exactly. The food is an important factor.
Sure.
What I try to do in my practice, I try to kind of pin down exactly what they like to eat and kind of teach them to do a little bit more calorie counting, and especially low carbs, because some people, they don't know how much carbohydrates, that's like with the high sugary how much sugar they are actually ingesting in all these processed foods and things like that. So I try to teach them a much more balanced and healthier ways. I don't believe in like the 1-day diet or 3-day diet, or the cabbage or the soup diet or grapefruit diet. There's so many out there. I think the best one will be kind of much more balanced and low carb, and a much more individualized program, individualized diet, because not everyone is the same. Probably something that you like, I won't like, or I don't eat in a regular basis. So I try to consult the patients and help them out with that.
Okay, Doc. Well, it's very nice that you came and shared that with us.
Reggie.
And
I appreciate it.
You're welcome back anytime.
Thank you.
Believe it or not, y'all, she was real nervous about coming on the show.
Yes, I was.
And you never believe it from looking at her. I mean, she's a pro. And Doc, anytime you want to come back, come and talk to us and share some of your knowledge. Everyone, go see Dr. Gabrielle at Opelousas General Healthcare System. She's at the South Campus, which is the old doctor's hospital, but she'd be glad to see y'all. And thanks, doctor. And
thank you so much, Reggie.
And thank y'all for joining us on Healthwise, and we'll see you next week.
honesty. Pass it on.
You're watching KDCG TV, uniquely Acadiana.